In terms of sleep, it tackles a variety of medical and psychological conditions that may cause disruptions. Additionally, because the sleep-related acupuncture points serve to calm the mind and body, they can aid in falling asleep and staying asleep. A typical acupuncture treatment lasts around 15 minutes, but can last anywhere between 5 and 30 minutes. After 30 minutes, no benefit is gained, and the session should be terminated. Acupuncture is performed by piercing the skin with thin, stiff metallic needles that are activated by the practitioner's delicate and particular hand gestures or electrical stimulation. Acupuncture is a traditional Chinese healing technique that dates all the way back to ancient times. The human body, according to traditional Chinese medicine, contains around 2,000 acupuncture points that are connected by channels or meridians. These routes allow for the circulation of energy, qi, pronounced qi, throughout the body, which is necessary for overall wellness. A blockage in the flow of energy might be the source of the illness. Acupuncture at certain locations is thought to increase the flow of qi and so improve health. Acupuncture in the real world. One of the most destructive experiments ever conducted on acupuncture proved that it works, even when the needles are inserted into a rubber hand. Qi, Kai, or Kai. Ji and Kai are not synonymous with Kai and Qi. Ji, Kai is a philosophical concept, a mode of thought that is difficult to express and explain, however the terms pole or ultimate suffice. Qi, Chai is a Chinese name for breath or vital energy, analogous to the Western concept of vis vitalis, life force, or the Greek pneuma, breath, spirit, soul. And this is the essence of acupuncture. Promotes the methodology outlined in the doctors undergoing extensive therapy may develop an acupuncture anxiety disorder regimen. The inspection is concentrated on. To seal in the outcomes of the treatments, heat or advised washing is used. They might include unintended consequences such as the influence on a low or a massage. Anyone who uses cookies to isolate these stones should anticipate taking full use of the needle's puncturing capabilities. It is recommended that more research on acupuncture for stress be undertaken on experts who would disseminate the findings. Flowchart of anxiety paired with application times. Individuals who went through the acupuncture protocol for anxiety disorder. For the sake of simplicity, this study protocol was classed as young men and female who merely condition. Syncope is largely caused by a decrease in blood flow to the brain, and symptoms include dizziness, perspiration, pallor, and blurred vision. Certain individuals may even pass out when they laugh or sneeze. This has been observed in patients who have not had an adequate amount of food before to their acupuncture session. As a result, doctors should be aware of syncope as a common symptom. However, this is not a life-threatening situation, and hence you do not need to be concerned. If you have any of these symptoms during your appointment with us, you must reschedule. What might possibly have caused this? Acupuncture's goal is to rebalance the qi in your body when it is overused and insufficient for healing. Acupuncture for anxiety is one of the therapeutic modalities in which I have watched some of the most remarkable changes in patients over the years. The moving stories of patients who have regained their lives as a result of acupuncture speak for themselves and indicate how acupuncture may have immediate, effective, and long-lasting benefits in treating anxiety disorders and related symptoms. While acupuncture is frequently used to treat physical ailments, it may be more effective as a mental health treatment. What is the acupuncture theory? As with acupuncture, acupressure is a comprehensive treatment with origins in ancient Chinese medicine, TCM. Both acupressure and acupuncture are predicated on the premise that certain ailments can be alleviated by stimulation of certain body locations. We may have a profound effect on our health by walking along invisible lines called meridians that run through our bodies. TCM practitioners, on the other hand, believe that stagnation or blockages in the meridians of our bodies can result in discomfort, agony, and even disease. Acupuncture is predicated on the idea that certain levels of energy flow throughout the body and are required for optimal health. Qi, or Kai, are the terms used to refer to this point. Unfortunately, energy flow can be disrupted for a variety of reasons, manifesting as sickness. Acupuncture balances this unbalanced flow by inserting needles into certain locations near the skin. They keep an eye on the energy flow and work to minimize disruptions. What is acupuncture's method of action? What does it actually do? By merely referring to moving qi, and portraying qi as energy, going via unseen meridians, those of us who perform acupuncture in the West have done medicine a disservice. Being a skeptic is second nature to me. My intellect is inquisitive, and I am not readily influenced by trite occult explanations or Western scientific reductionism. Thousands of years ago, millions of individuals used acupuncture to treat a wide variety of health problems. Acupuncture alters the flow of qi, the body's life force energy. In Western medicine, what is referred to as qi in Eastern philosophy refers to the body's natural chemical processes, with irregularities corrected with medications. Qi is believed to circulate across meridians in Eastern medicine. Disruptions in this flow result in physical or mental illness. When the flow is restored, the body's health returns to normal. What about the safety and adverse effects of acupuncture? Acupuncture has an influence on conventional medicine since depression can be induced by an imbalance or blockage in one or more of the body's organ systems or meridian pathways. If the qi is clogged or inadequate to effectively fuel the organs, this can result in illness, and emotional problems. Acupuncture improves naturally and without the need of drugs, withdrawal symptoms, or addiction. Acupuncture is a relatively safe procedure. We use sterile, single-use needles that are sealed by the manufacturer and opened immediately prior to usage. Acupuncture is associated with few, if any, adverse side effects, which may include mild bleeding, pain, or bruising at the acupuncture site. According to the National Institutes of Health, acupuncture's adverse effects are extremely modest and often fewer than those associated with conventional therapies. Additionally, they stated, acupuncture poses little risk when conducted by a professional, certified acupuncturist using sterile needles. The most common side effects include pain and mild bleeding or bruising at the site of needle insertion. Disposable needles have become the industry standard, significantly lowering the risk of infection. On the other hand, acupuncture is not for everyone. If any of the following symptoms apply to you, you may be at risk of developing problems. Smoking draws you into a vortex from which there is no way out. As a result, there is no one-size-fits-all approach to assisting a smoker in quitting. Numerous ways are available to assist smokers in quitting. Regrettably, the majority of aids or meals used to quit smoking become a cause of addiction. On the other hand, acupuncture has no detrimental effects and